Hello, I'm Brenda Dater, Executive Director at AAME. This past week, the White House suggested that Tylenol use during pregnancy might cause autism. This is not true. A massive Swedish study involving nearly 2.5 million children found no link between acetaminophen and autism. Yet the administration's baseless claim does more than mislead. It stigmatizes autistic people, frightens pregnant people, and drags us back to an era we thought we'd left behind. I have spent decades working alongside autistic individuals and their families. I also speak as the parent of an autistic adult daughter. I know firsthand the strength, creativity, and insight autistic people bring to our communities. I also know the pain families feel when misinformation tells them their child is broken, or worse, that they are to blame. This is not the first time mothers have been targeted. In the mid-20th century, autism was blamed on so-called refrigerator mothers, accused of being too cold to bond with their children. That cruel theory left parents feeling ashamed and children misunderstood. Today's rhetoric, pointing fingers at pregnant people for taking a common, safe medication, echoes the same blame. We cannot go back there. The real crisis is not rising autism rates, which reflect better awareness and broader diagnostic criteria, but the erosion of services and protections that help autistic people thrive. Cuts to Medicaid and weakening the Department of Education are stripping away supports for those who need them most. Families across the country are left fighting for school accommodations, healthcare, and community inclusion. These are the issues that deserve national attention. Misinformation about autism is not harmless. It shapes policy, stigmatizes people, and distracts from urgent needs. When leaders claim that autism is caused by Tylenol, vaccines, or parenting, they give cover to policies that slash services, ignore accessibility, and sideline autistic voices, autonomy, and self-advocacy. They also drive wedges between families and the very systems that should support them, and between doctors and their patients, threatening public health. Autistic people and their families need understanding, not scapegoating. They need investment in education, healthcare, and employment pathways, not fear-mongering about causes long disproven. They need inclusion and belonging, not outdated rhetoric that stirs panic and blames mothers. As a community, we can resist this harmful narrative. We can elevate autistic voices and self-determination, demand adequate funding for services, and push back against disinformation that threatens both science and dignity. Most of all, we can remind parents and families, your child is not broken, and you are not to blame. Autism is not an epidemic. Disinformation is. And the cure is accurate and verifiable information, compassion, and support.